So we did a session today. It's a geriatric assessment workshop, and it was kind of like a round robin where the participants sat at the table and we went over all these different screening tools. My screening tool that I went over with my colleague was the Vulnerable Elder Survey and the G8. We mainly focused on the Vulnerable Elder Survey because it's just a little bit harder to do. We presented a case and they filled out the form, and then we answered any questions. So it's a good way to actually be interactive and having them understand the tool a little bit better. Yes, it's called the Vulnerable Elder Survey 13, and it has 13 questions. Basically, it's looking at a lot of the functional status of the patient. So can they do their activities of daily living? Can they go shopping? Do they need any help with certain things? And the patient answers the questions, specifically indicating whether there's difficulty or not. And you score it at the end. And the cutoff for this tool that's been validated as a 3 or higher. So anything greater than 3 or 3, they would be referred to maybe a geriatrician or have further geriatric assessment tools done on them. So if they use the tool in their clinics, they could again refer to a geriatrician or do a comprehensive geriatric assessment on this patient. So it just provides it's a pre-screening tool. To see if they need more assessments so that they can get a better picture of the patient. A lot of times the tools themselves will kind of help guide your maybe treatment plan, and you would then have a better idea of what the patient's functional status is, nutritional status is, their mentation, because there's various tools that have all been validated, so you don't have to make up a new one basically. Nurses can play a critical role in making sure the tools get done. So a lot of times, like the physician that I was working with, he didn't really have anybody but himself to do the tools. But in the United States, we have nurses who are actually completing the tools and then making the recommendations to the physician potentially, or giving the information to the physician so that the physician can go ahead and say, yes, this patient needs further assessments. A lot of the questions were related to the cutoff. Some of the questions, one of the questions is related to housework. And if you ask the male whether or not they do housework, they usually will say, no, I don't do it. But so you'd have to maybe dig a little deeper and find out, can they do it if they had to? Because again, it's with difficulty, no difficulty, unable to do it. Those are the kind of questions you're asking the patient about different tasks. And so you may need to probe the patient a little bit more to find out if they actually had any functional deficits that you should be aware of. I was going to say, well, I was going to mention that there's a lot of these resources available out there for the nurses to look at. There's the consultgeri.org, which has a lot of the tools there that you can go to. Of course, mycarg, mycarg.org is another great place where it's geriatric oncology focus, and some of the tools are there that you can just go ahead and familiarize yourself with so that you can get a better idea of what these tools are. And I think nurses really can play a big role in kind of bridging the gap between the fact that we don't have a lot of geriatric oncologists, we don't have a lot of geriatricians, and nurses can bridge that gap to help with this population. I think there's a lot more awareness that has to happen. So getting the nurses educated on these tools would be very beneficial to the clinicians that they work with. So just more education around the tool. And then again, starting to use it. But whenever you use tools, you have to have an intervention. So if you're actually gathering this data or finding out what the patient's needs are, then you have to have an intervention to go with it. So kind of working out all of that before you start using the tools would be beneficial.